Same-day surgery and the Post-Anesthesia Care Unit, or PACU, are part of Children's Mercy perioperative services. We work with surgical patients from all subspecialties to provide exceptional pre-op and post-op care. Same-day surgery is where patients who are coming from home to have surgery check in and prepare for their procedure. The PACU is where we monitor patients in the immediate post-op phase. Our nurses see a wide variety of patients, ranging from simple to complex. Our patients are diverse, and so is our job. Our nurses are doing two different kinds of work. In same-day surgery, you're acting as a clinic nurse, and in the PACU, you're acting as a critical care nurse. Because our nurses function as both clinic and critical care nurses, our training is extensive. New nurses to our department go through 16 to 20 weeks of orientation to ensure that they can provide pre-op and post-op care to any child having surgery. All of our nurses are required to be certified in Pediatric Advanced Life Support, also known as PALS, because one of our main jobs in the PACU is airway management. We don't rely on an outside code team. Our nursing team works with our anesthesia team to manage any airway event or code event in the PACU. Similarly, we don't have a respiratory therapist in the PACU. Our nurses act as RTs as well. Another important part of our job is post-op pain management. Our nurses titrate medication to treat pain and set up PCAs, epidurals, and other pain infusions. That's something you'll learn during your orientation as well. We have small teams who specialize in certain skills, like starting IVs, accessing ports, and turning on and off vagal nerve stimulators. There are a lot of opportunities to learn and enhance your skills. In our department, all of our nurses work set schedules, with shifts starting as early as 6 a.m. and ending as late as 8:30 p.m. We are a 24/7 operation, and we stagger our start times to make sure that we have our most experienced nurses across all of our shifts. Full-time nurses work 4 days a week, plus a call component. You're always off the day after you're on call. You're assigned to either work in same-day surgery or PACU on any given day, but it's not uncommon to get pulled to the other if there's a backlog. In same-day surgery, the nursing assessment and teaching time varies based on the complexity of a child's medical history as well as the complexity of the surgery. We have a 1-to-1 nurse-to-patient ratio in PACU. For medically complex patients, we oftentimes have a 2-to-1 ratio. The number of patients you care for in one shift depends on the complexity of cases. After surgery, kiddos stay in the PACU for about 55 minutes on average. You'll be with your PACU patient the whole time and then deliver them to wherever they need to go, whether that's discharge or one of our inpatient units or ICUs. Hands down, we have the best teamwork in the hospital. We operate from a place of yes. It's palpable when you walk in our area. You can see our willingness to help each other out. It's a really strong team dynamic. We have a nice mix of veteran nurses and newer hires. We have some fun traditions, like bake-offs, team building events, and community service days. The most challenging part of working in same-day surgery and PACU is the complexity of our patients. We're also busy. You're running from the time you get here until the time you leave. Call is one of the most rewarding components of our job. When the phone rings at 2 a.m. after working all day, it's hard to get out of bed. But you and one other nurse are tasked with serving a patient that no one else in our region can care for. It's humbling to think while you're driving in, I'm it. Families come here with their most precious assets and hand them over to a member of our team to do something really, really scary. They are saying, I trust you to provide excellent care for my child. That's an amazing thing. But I look around and think, yes, there's nobody else I would want to take care of my child or take care of me.